Hi everybody, this is Dr. Charles Stevens. I'm a doctor of physical therapy and the founder of Mobile Therapy Services. I do have an RMSK board certification, which stands for Registered in Musculoskeletal Ultrasound, which is the highest level of musculoskeletal ultrasound proficiency that one can attain. It is a physician credential. Dr. David Lintonbon and I of the British College of Osteopathic Medicine are hosting a 3-day intensive course here at my Dallas office in Dallas, Pennsylvania. This course will essentially teach you how to perform basic diagnostic musculoskeletal ultrasound, as well as combine that with osteopathic assessment and treatment. This is a one-of-a-kind course, unlike any other. I'm going to do a brief sample video of an elbow exam. This would be appropriate if you had a patient that had a recent fall, landed on an outstretched arm, they present to chiropractic or osteopathy or physical therapy, and we're going to ultrasound that patient as a point of care service. So I have my linear transducer here, and I got my own elbow. If I get myself in frame here, we have an articulation there, and I'm going to just show there's two bones stacked on top of each other. We can see it on this screen. The upper articulation is the humerus, and underneath that we have the ulna and the radius. If I turn this 90 degrees, we can clearly see the articulation. Distally is going to be the radius, and more proximally is going to be the humerus. So there's a humeral radial joint. If somebody fell and we suspected a proximal radius fracture, you can see that very accurately if there's any sort of cortical irregularity along the head of the radius. Also, if there's any joint effusion, and also you could check it with a tuning fork. If they fell and you want to assess the radial collateral ligament very easily, we can turn the transducer, and we have two articulations there. Two bones there. We have the humerus more proximally, and distally we have the radius. The top 60% of the line on of the humerus there would actually be the common extensor tendon, and below that, more inferior or deeper, we have the radial collateral ligament. Between the two bones, we actually have an accessory structure, and I have one. It's actually called a synovial fold, which is pictured there between the articulation. So just wanted to show everybody how quickly you can maneuver around. If you wanted to see the tricep tendon, you can immediately turn, and now we're looking at the large tricep muscle. I can move and contract the muscle and see is there a partial or full thickness tear of that tendon. And also we can see the articulation, or any loose bodies or joint effusions might come out. So if this would benefit you or anybody you know, please call our office at 570-282-9382 to register for this conference, or email me at charles.stevens@mobiletherapyservicesnepa.com.